If you want to ace your medical school interviews, making sure that you actually know the content when you're answering questions is so important. So to help you learn the content, in this video, we're going to be covering healthcare inequalities and postcode lottery. Some of the topics we're going to be looking at include the Marmot Review, BAME in the NHS, and the North and South Divide. These are all really important to understand so you can talk about and actually understand the healthcare inequalities that are in the UK. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship, and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Let's start off by looking at BAME and the NHS. So BAME refers to Black, Asian, and ethnic minority groups. Now, looking at it from a NHS staff perspective, it's been shown that BAME groups are actually in a minority, especially at a senior level, and typically they are less likely to be in those senior positions. Now, looking at this from a patient perspective, unfortunately BAME groups often have worse health outcomes in comparison to white patients. Unfortunately, BAME patients can actually face inequality when accessing NHS services, and especially during COVID, BAME communities were unfortunately affected disproportionately in comparison to other communities, meaning that they had often worse health outcomes during COVID. This is a really important issue that needs to be addressed to ensure that all staff and patients are being treated equally, and the NHS has different points that it's using in order to address this issue. The first is to actually develop networks across BAME staff to give them an opportunity to talk through their experiences and give them that support. Second is actually to address unconscious biases that NHS employers could have as well. And third is to increase the representation of BAME NHS healthcare workers at a senior level, so it's more reflective of the patient population that it serves. Now let's take a look at the North and South Divide, because even across northern and southern parts of England, there is actually a difference in the access to healthcare. There is a difference of 2 years of the average life expectancy between northern and southern regions of England. Additionally, high income deprivation is often more commonly occurring in the north, and within the north there's also more instances and percentages of people who suffer from different conditions such as obesity and mental illnesses. But why does this disparity actually exist? Now, one of the reasons for this is because economic recessions have actually had a greater impact in the north than in the south. This is why there are often more high income deprivation families in the north in comparison to the south. Additionally, northern areas often have access to less healthcare, meaning that there's fewer healthcare services and also longer waiting times as a result. Now, one thing that the NHS is doing to address this healthcare gap is actually doing collaborations between the NHS and local councils and communities to actually give targeted healthcare services and support to areas which don't have as much access to healthcare. Also, a disparity in the delivery of healthcare between rural and urban areas. Now, the reason for this disparity is because typically in rural areas there is fewer healthcare services, and this means that there is a lot more greater travel time that patients have to make, and it also means that within hospitals or within primary care there is longer waiting times due to that being less resources or less services present in that area. As a result, this means that patients often have that long waiting time, and it means that even though there are fewer doctors who typically work in rural areas, there is long waiting times, which could also lead to burnout and stress for the healthcare professionals who work in these areas. Due to the limited access to preventative care and also to different healthcare services. This is what results in, unfortunately, worse health outcomes for those who live in rural areas, as they're at greater risk of different conditions such as chronic illnesses like heart disease and obesity. In urban areas, it's often more easy to access different healthcare services like screening programs and preventative care services, which is why that in urban areas there are typically better health outcomes in comparison to rural areas. One of the initiatives that has been designed in order to address this disparity is the use of telemedicine and telehealth services. Now, telemedicine is using technology in order to be able to address these disparities and providing things like GP consultations via video call or on a phone call instead. Again, this increases accessibility and could minimize the impact of this disparity. Now let's take a look at Postcode Lottery. Now, before we get into it, it's important to highlight that the NHS is actually split into sub-organisations, and this is done geographically. So this means that different amounts of resources can be provided to different geographical areas. This could actually lead to an unequal distribution of resources, which means that different areas may not actually get all of the healthcare services or the resources that they need in order to be able to support that population in that area. And this is where the idea of postcode lottery and the disparity comes into play. Most commonly, postcode lottery is affected by socioeconomic conditions. So areas that have a lower socioeconomic status often have worse healthcare outcomes and less access to different healthcare services, whilst areas which have a higher socioeconomic status often have access to different and more healthcare services. In order to address the issue of postcode lottery, one of the things the NHS has done is change the way it gives out its funding and the money to different areas of the country. This means that the funding can actually be more patient focused. Additionally, it's really important to talk about the idea of justice and mention this in your interviews, because one thing that's really important within the NHS is to make sure that everybody has fair and equitable distribution of different healthcare resources, that no matter what area or what part of the country someone is living in, they're actually able to have access to healthcare services in comparison to someone else who is also living in another area. I hope this video gives you a really good understanding into the different healthcare inequalities that are currently in the UK, and also the initiatives that are currently in play that can address these different healthcare inequalities, and you can mention these in your interviews to show that you understand that these disparities exist, and the aim is to actually reduce the gap between different healthcare inequalities in order to make sure that healthcare is actually accessed by everyone and is equally beneficial to everyone. Don't forget to check out my other videos on my channel so you can learn all of the content that you need to know to ace your medical school interviews.